Hello and welcome back to the Works of Faith Wellness and Consultation channel. If it's your first time visiting, my name is Dr. Dorina Alfred and I am the owner of Works of Faith. Today I thought I would spend just a couple of minutes talking about how we as fourth trimester and beyond parents can help our children manage anxiety and stress. And this is more for people who have school age children. So there can be a tendency for us when our children are anxious for it to make us anxious and stressed. Makes total sense. But in that, if we're trying to assist them in managing that, there are a couple of things that we should be mindful and try to do. First of all, really trying to get an understanding of what's kind of underlying, what's at the root, what's really bothering them, what's creating the stress for them. Once we have a good understanding of that, we can help them to start to problem solve, put resources in place, and those kinds of things. But sometimes what happens with our children is we can ask them a question and say, hey, what's going on? And we get the answer, nothing. Right? So when we get that answer, there may be a tendency to say, well, I know something's bothering them, but I'm not sure they won't talk. Part of our job is we have to kind of discern when to push and press and when to kind of back off, especially with older teenage kids. And so one of the things, though, that we can do is find times to talk with them that don't feel very threatening, kind of benign, not given necessarily sole focus and attention, but talking while we're doing something. So talking while you're driving, talking while you're cooking, spending time together. You can kind of sneak in, not necessarily sneak in, but you kind of slide in some questions that are very pointed in a way that they may feel more open to discussing. So first point is allow time for conversation. And if you need to, then dig a little bit deeper. You have to time it right, but there is a need sometimes for us to dig deeper because sometimes our children are struggling with a lot more than stress and anxiety, and we've got to be able to communicate and pick up on what's happening. So after that, after we kind of get a sense of what's going on, can put resources in place, help them develop strategies. One of the best ways for us to help them develop strategies is to model healthy stress management and anxiety management. So that means we have to model how to manage stress effectively and in a healthy manner because they're watching. So if we're doing something and our anxiety or our stress is not well managed, then of course they're going to see that and pick up on that. So we have to do our due diligence in taking care of ourselves, doing counseling or therapy and doing self-care, whatever it is that helps you to do that in a healthy manner, exercise, monitoring your diet, all of those kinds of things. But modeling is really key. And then lastly, if you don't practice mindfulness, I'd say give it a try. The practice of mindfulness, of being focused on the present moment, can be a very effective strategy for anxiety and stress management. And if you're practicing, then you can introduce that to your young people and help them to develop that as a coping strategy early on. So those are my tips for today. Hopefully something stands out as something that might be useful to you. Keep tuning in for our next conversations about perinatal mental health from preconception, pregnancy, postpartum, and beyond. Look forward to talking with you soon.